Okay, my speech is about dementia. When you hear the term dementia, what is the first thing that comes to your mind? Is it forgetfulness or not being able to think clearly? We often hear the terms Alzheimer's or chronic syndrome. All of these terms are used to describe symptoms of same disease known as dementia. Doctors recently started referring to the term neurocognitive disorder. Instead of dementia, some of the major symptoms of this disorder are memory loss, disorientation, and intellectual impairment. Alzheimer's disease is the most common cause of dementia in adults, which is linked to the intellectual impairment and progresses from forgetfulness to total disability. According to Nancy Mace, another common cause of dementia is vascular dementia, which usually occurs after a series of small strokes. Also, it can be caused by other diseases that affect arteries in the brain. A person who is more prone to strokes destroys bits of the brain, which affects their memory functions. Another term for this that we hear used is hardening of the arteries. People with dementia may be diagnosed with other illnesses which make them more vulnerable to other health problems. Some patients can also develop delirium and can make their mental functions and behavioral worse. Now that we've learned about some symptoms that develop with dementia, let's take a look at the mental symptoms that are affected with this illness. According to Mark Beers, dementia can make using language more difficult, which results in using words incorrectly or being unable to find the correct words. Using numbers such as adding, subtracting, and handling money become more difficult. People with dementia may often ask the same questions over and over, constantly forgetting where they put things. They also often have tendencies to forget important tasks, such as paying bills or more so sending wrong amounts, causing them to be frustrated. Or they can even forget signing checks. They may use general words or many words instead of specific ones. For example, that thing around the collar may be used for a person trying to describe a necktie. People with dementia have unexpected personality changes. These include depression, fear, anxiety, or just being unresponsive to emotions. One example is people who are always concerned with money may become obsessed with it, and these emotions can occur unpredictable. They can also have memory lapses, which can affect their everyday lives, such as demanding a meal after already having one and forgetting that they have already eaten. Some people may often use cruel language, and aggression may occur without them realizing it. People with dementia can often have sleep problems occur. They normally sleep enough, but lack the deep sleep their body needs. And if they sleep too much during the day, they could become restless and lose sleep at night. This can cause them to wonder or yell out for other people. So, yeah. According to the Alzheimer's Association, many dementia symptoms are progressive. This means that they start out slowly, gradually get worse. There are many areas of the brain that dementia can affect, including memory, judgment, and movement. And once the cells in the part of the brain controls a function, then the region cannot carry out the task. The region of the brain called hippocampus is the area of the brain that controls learning and memory. and is normally the first area affected by Alzheimer's. This is the reason why memory loss is one of the first symptoms to occur in Alzheimer's. Most changes that happen in the brain by dementia are permanent and get worse with time, but symptoms may actually improve. Some of them. Among these are thyroid problems, depression, vitamin deficiencies, which can be improved if treated properly. So now we learn how dementia occurs in the brain. Then we learn some symptoms and side effects of the illness. And lastly, we saw how it affects certain areas of the brain and cause the brain to lose control over certain functions or emotions. Alzheimer's disease is the most common cause of dementia in adults, which is linked to intellectual impairment and progresses from forgetfulness to total disability. So I hope that if you or a family member knows anyone who may be suffering from dementia, that you take immediate action to make sure they get the time and the care they need. And I hope that the resources information you've learned today will give you the help you need to protect those around you in need. Thank you.